Hey everyone, Dr. Garza here, and I'm so glad that you opted in to watch this video. First off, just want to tell you how excited I am to present this information. This is something that I've been wanting to do in this type of platform for quite some time now, and now with the amounts of time that we have, I decided to set a schedule and start doing that. And the main reason that I'm doing it for is for you, for the viewers, for our clients. There's a lot of people out there that, have stayed home because, it's the safest thing to do. But by the same time, they're also missing out on some care. And, there's people out there that maybe are not coming in to get treated or evaluated for something like back pain because they're maybe afraid or scared to go out and visit a doctor's office at this time, or, much less go to the hospital. So what I want to do for you is provide the type of information that I would provide to our clients when they first come in to see me for back pain. And I put together a presentation for you so that you can see how maybe you can start to identify some of these things that maybe you're feeling, and start to then relate yourself to those conditions, and then hopefully down the road, as I put out more content, you can find the content that's best for you, and maybe you can do it at home and start managing your pain, and start, living a better pain-free, healthy life. So I want to start off by saying that this in no way, shape, or form is anybody's evaluation. If you see something that maybe you relate to, that you say, wow, that's me, what I'd like you to do is, put it in the comments, maybe messages on Facebook, so that then we can get on the phone with you and do a thorough evaluation and make sure that that is what it is. So, if you relate to some of the things that you hear on this video, don't go and confirm that that's exactly what it is, because this in no way, shape, or form is meant to be an evaluation or a diagnosis, for that matter, for anybody. It's meant to be more of a source of information and resource to gather, and maybe then go and talk to somebody like a physical therapist or your doctor later and tell them, hey, I think I may have stenosis because of this, this, and this. Can I get it checked out a little further? So with that said, I want to go ahead and start. The topic of today's presentation is, the 3 common causes of back pain and sciatica. And that's something that we see here a lot. We've treated several individuals with this, of all ages. And quite frankly, it's something that has a lot of causes to it. Back pain and sciatica is not just one diagnosis. It's, a condition that is caused by something else, and it's up to us to find out what that cause is. So I'm going to go over the top 3 common causes of back pain that we see in the clinic, and how you can identify with them, so that then you can start to go ask questions and go seek some help. All right, so I want to show you why it is that we do what we do, and that is, for my family. I have a lovely family. I'm blessed to be married to a beautiful, loving, wife that's, super helpful with the kids. We got blessed with 2 kids, a boy and a girl, and they're twins. They're both 7 years old now. And, their names are Frankie and Tessa, and my lovely wife's name is Amy. So, we started this business, over 8 years ago, and, going on 9, and actually 9 going on 10. It's been a challenge, but, we were blessed, with these kids. And, the reason that we go to work every day, and the reason that we're so passionate about what we do and helping other people is, because of them. And we want them to have a better life than we did. Both Amy and I, grew up in small towns. We both met in college, at grad school. And that's where we fell in love and got, married a little sooner after graduation. And we started our business, and we had kids. And it's just been, quite a journey. So, if you've been into therapy with us before, and you know us, I mean, our family, because our kids were around the clinic so much at a younger age, and they still are today when we go in there and from school and stuff. So this is my family. I introduce you to them. It's why we do what we do, love them dearly, and you know, regardless of what everyone is going through, or sometimes, you know, when you have a bad day, you know, these are the things that just make that day just so much better when you come home to something like this. So next, I want to introduce to you our amazing staff. So, you know, over the years we started, and it was just myself and Amy as a therapist, but as we shared our message to, you know, many more people, and as we, you know, healed and, you know, consulted many individuals that ended up getting better and had great results, you know, we started to have to build a team that would, you know, believe in the same philosophy that we did, as well as treat in the same manner that we did to get the best outcomes and the best results. And, you know, in the last couple of years, we've been able to add 2 amazing therapists to our team. And that's Ruben Alvarado. He's a physical therapy assistant. And, you know, he's been with us for over a year now, going on 2 years. And recently we just hired Dr. Mario Garza, which is a doctor of physical therapy. And he just started with us at the end of 2019. So he's only been with us for a couple of months. But again, you know, since they've started, I mean, we've seen so much good, you know, words from our clients about their care and about how they work. And I've seen it myself in mentoring Mario through his first 3 months. And, you know, he's an excellent therapist. You know, we're all very diverse in how we treat and what we specialize in. And I think that gives us an edge, because, you know, we can bounce ideas off of each other and, you know, help, you know, clients, you know, through different, you know, therapists, not just one therapist. So it's a great atmosphere working with this team. Of course, you got my lovely wife, which is the most credentialed out of all of us. She's a doctor of physical therapy, manual therapy certified, and she's an expert Pilates physical therapist. So, you know, myself, I'm working on my fellowship. I'm manual therapy trained as well. We did the same coursework. But I'm currently working on my fellowship, and that's something that is, you know, more curriculum, more advanced work, and, you know, to better my skills as a therapist, so that then I can you know, teach the rest of the group, so that we can all accomplish the same tasks. And then we have Annalisa Seda and Alex Gonzalez, who are our PT techs, and they help us a lot in the clinic with patients and, you know, setting up, cleaning tables, calling everybody in, and whatnot. So they're an integral part of our team as well. All right, and then this leads us to our front desk personnel. We have Clarissa Ibarra. She's our front desk lead receptionist. She takes care of getting you on the schedule. She takes care of answering any questions you may have. She pretty much does the intake information, gathers all the information that we need to process your chart and get you qualified to come in and see us for therapy. And also does confirmation calls and reminders and things like that. So if you need to reserve a schedule, you know, you're most likely talking to her. If you need to change your schedule, you're most likely talking to her. But she helps us out tremendously in the front, and we're very grateful for her. And then we have Bruce Salas. Bruce is, does a little bit of everything. He's one of our, he's our client care representative. So he's basically making sure that there is nothing wrong with your charts. He works with our billing company to ensure that, you know, you're qualified to be in, and check your benefits. And so he does insurance verifications, authorizations. They both do all that, but Bruce kind of leads the way on that. And Bruce also helps us with our marketing. So again, he does a little bit of everything. He's a utility player, but he will also be scheduling at times and answering phones. But Bruce has been with us for going on 2 years now, maybe a little bit more than that. And Clarissa just started within the year. So they're both very helpful at the front desk. Any questions you may have, you can ask them. If you contact us through Messenger or Facebook and stuff like that, you know, we're all there to help answer any and all questions. So really appreciate their help at the front desk. And that's our team. So let's go ahead and move on to the rest of the presentation. So now what I'd like to do is, before we get started, I'd like to show you a case study from one of our patients that actually was dealing with back pain and leg pain. And when she came to us, you know, she couldn't hardly walk or move around. So why don't you take a minute to kind of just listen to her story so that you can see kind of the effects that, you know, we have on some of our clients.
My name is Rebecca Rankin, and I am a nurse practitioner not working right now, and I've been having severe leg pain in my left leg. And I remember especially January of 2018, we went to see our grandchildren and their parents in Tennessee, and I was using a cane and I could hardly walk. Most of the time I stayed home when they went and ran errands and did things. I wasn't up to doing it because of pain. And then I saw your ad for a Saturday workshop for back and leg pain. I liked your attitude and that you felt that surgery was a last resort. I started noticing improvement right away. Some of the pain decreased and I needed less pain medication that I was taking. So I've gone from doing the stationary bike to the treadmill. And I haven't used the treadmill for a long time.
Wow.
So now I'm up to a speed of 1.5 miles per hour, and I've done 15 minutes, 2 days running. And I've gone now for about almost 4 weeks without using the cane.
So I hope you enjoyed that clip. As you can see, you know, we deal with, you know, individuals that sometimes are in a condition where it really affects their daily activities. And it's the second most common reason for a doctor's visit. Can you believe that? Okay. Experts estimate that as much as 80% of the population will experience a back problem at some point in their lives. So you can see those are some pretty astonishing statistics. And quite frankly, you know, it's true. We see this a lot in our clinic, and it's, you know, the majority of the population that we treat, you know, and that's why I want to share this information with you so that you can identify if this is you, and if so, you can seek out the proper treatment for it. All right. So if you're listening to this video, what I'd like to do now is just share a little bit about what you're going through. So if you don't mind, go ahead and put your comments or put your name in the comments section below. It says, you know, obviously you want to state your name if you feel comfortable doing that, or just plainly state, you know, what you're going through. You know, if you have back pain, you've had it for a long time, maybe you just got it. And this should be, you know, anywhere in the last 30 days. So if you've had back pain in the last 30 days, I want you to go ahead and comment below in the comments and just briefly describe it and let us know what you're feeling. These are a couple of more testimonials. These are from people that we've treated here at Pure Physical Therapy. It says, I came in with neck and back pain, along with numbness down my left leg. After doing my physical therapy, I noticed a difference. My numbness disappeared, and I was able to regain a lot of my mobility. So now I'm able to be more active and have resumed activities that he had avoided in the past. I would definitely come back for any future needs and recommend Pure Physical Therapy to anyone suffering from chronic pain. So that's one. He actually came to one of our workshops that we did. This is another one. I've been having problems with back pain, scoliosis, and her shoulder. She also came to a workshop. She was actually volunteered on one of our workshops, and after I worked on her, you know, she came back and she still continues to do her exercises. She got really strong, and again, you know, had really good outcomes. All right, and then the last one here. So this is somebody that drove down here. So we get a lot of winter Texans here, and she drove down from Iowa. She had developed sciatica with pain down the leg into her ankle. She had had past physical therapy with no help. She did a bunch of cortisone shots. She was recommended by a friend. I did an evaluation with her. She decided to give us a try. Needless to say, that compared to her past experience, she really did not think that we could help. But to her surprise, you know, after 6 weeks of attending and faithfully following her exercises at home, she's pain-free. So she thanked us for that, and her name is Mary Rowland. So I appreciate that. But that's just a little bit of what we do, and just proof that, you know, we really are, you know, passionate in what we do and helping people for one, but not only that, the way that we do it. So All right. So what I want to do here is I want to, if you're watching and you're at home, I want you to get up and we're going to do some little movement testing. Okay. So the first thing you're going to do, we're going to ask yourself to stand up. Okay. And you're going to bend forward like if you're trying to touch your toes. Now, the reason we're doing this is because we want to find an area or emotion that may be causing you some pain, limitation, maybe some stiffness, achiness, or whatever. And we're trying to identify that. So just make note of that. Did it hurt? Did it not hurt? Was it limited or was it pretty good? Okay, now the next thing you're gonna do is you're gonna bend side to side, okay? So I'll stand up and show you that. So the first one is bending forward like this, okay? The next one is side to side like this. So you put your hands by your side and you just go side to side. Rotate that way. And then the last one, you put your hands on your waist right here and you're gonna try to go backwards, okay? Now, those are the four, so forward bending, back bending, side bending, rotation. Those are the four primary motions of the spine. And depending on what hurts or what doesn't, we can kind of identify more or less where your restriction is and, start thinking about what you may be having or dealing, and then we can do more testing, right? So what I want you to note right now is, I want you to note, do you have pain with any of these motions? And if so, which ones? All right, so again, please make note what motions caused you pain, because it's time to give you some solutions to your back pain and sciatica problems. All right, so like we mentioned, there's three common causes, right? There's three common causes of back pain. The first one is a herniated disc. Second one is stenosis arthritis, degenerative disc disease. And the third one is SI joint pelvic dysfunction. Okay, so I'm gonna go ahead and go through some of these things, and what I want you to do is just note at the characteristics that I talk about and see if some of these are things that you're currently feeling. Okay, so here we go. Herniated disc. So herniated disc, if somebody's having a herniated disc problem, if it's a severe one, they're gonna have a lot of pain. Now, sometimes it's not as severe, but certain motions will cause the pain. For instance, if you look at this picture here, down here where it says herniated disc, you see that that disc is really bulging into that space that comes out there. So that space, that's where your nerves come out of. And if a disc is inhibiting the ability of that nerve to exit that canal, then you're gonna have pain down your leg. You're gonna have burning, tingling, numbness type pain. Now there's different classifications of the disc, and as you can see there, the normal disc at the very top has a very good disc space. It's hydrated and it's got a nice little space. The second one is degenerative disc. This happens to half the population over 50, or mostly everybody over 50. And all it is that the disc starts to dehydrate. So it loses its water. So then in that retrospect, it loses its disc space. And then there's a bulging disc, and then there's herniated disc. And then there's a thin disc, and then there's disc degeneration with osteophyte formation. So, those are some of the levels of disc problems. A lot of the times, we get an MRI and it tells us you have a bulged disc. Well, I may have a bulged disc too, and I don't have any pain. There's a lot of studies out there that, take 10 different people without pain and 10 different people with pain into an MRI, and both groups have herniated or bulged discs. So don't always become your MRI. There's what that tells me is that there's a secondary reason why that disc is getting bulged, and we need to find that out. So, usually when you have a herniated disc, if you felt pain while bending forward, you could fall into this classification. Now, not to say that that's the only thing that's causing it. It could be a stenosis problem too, and it could be just muscle tightness, right? Okay, so usually this herniated disc is caused by a disc pushing back or compressing a nerve. The pain can be extremely painful. It's most commonly occurs at L4, L5. In this condition, you'll have pain with lifting, coughing, and sneezing. You can develop foot drop. You'll have pain with sitting. And actually, when you have a herniated disc, your pain is relieved with standing and walking. So a lot of people will stand up and move around because it says that they say that feels better. This is usually happens in younger individuals, and a lot of the times people ask me, well, I have a herniated disc. Can it heal? Of course it can. Okay, there's certain degrees of herniated disc that can heal if done the right thing, doing the right things and the proper treatment. Okay, so that's the first and most common cause of herniated discs, or the first common cause of back pain, I'm sorry. And here's a picture again of how that herniated disc pinches a nerve. All right, so now we lead into the second most common cause of back pain. And this is stenosis, arthritis, and degenerative disc disease. Now this here is classified as the second most common cause. As you can see here, when you have stenosis and arthritis, degenerative disc disease, basically, stenosis means narrowing, right? So if this is your spinal canal, you have so much arthritis around the borders of the canal that now it's narrowing and it's becoming stenotic, okay? So when that happens, you can pinch your spinal cord, you can pinch the nerves coming out of the lateral foramens of the spinal vertebrae. And again, it can cause pain, tingling, numbness down the leg. And that's the sciatica classification. When they say, oh, you have sciatica, most usually it's, all right, back pain that radiates down the leg and it feels like pain, numbness, or tingling. So here, typically this person has pain with standing and walking. So this is opposite of a disc herniation. So very, very important to classify what is the main cause to your pain, so that then we can have the proper treatment approach. Because for stenosis, you're not going to do the motions that you would do for a disc herniation. If you think that you have a disc herniation and you're doing extension exercises and it ends up that you have stenosis, then you're going to make that condition worse. Same thing if you have stenosis, or if you have a disc herniation and you think you have stenosis and you're doing flexion exercises, then you're probably going to make that worse. So again, this person here, they need to sit down or they need to bend over while they're pushing a cart on the grocery store. So they need to cause that flexion type position. They need to sit down. Oh, okay, I need to sit down because my back's giving out, my legs are feeling weak, I can't walk. They have painful and limited backward bending. So this individual will not be able to bend backwards when you're doing the standing test. So the test that we went over earlier, they will not be able to go backwards. Usually they're 50 years of age or older. They're very symptom specific. They'll talk about exactly where their pain hurts, and it can change from side to side, but it's usually always right along the area of your low back. So these patients have, complaints of pain first thing in the morning, and, they feel very stiff. And they do say, though, that as they warm up, it does get a little better. Some of them will complain of crampiness, heaviness, and weakness in the legs. And like mentioned, it can either be very specific or it can change from side to side, depending on what they're doing. So if you can see there the picture where you have the stenosis and the arthritis, see how it can really damage your nerves and really pinch your nerves there, which facilitate the lower extremities. It's just another picture to illustrate the vertebrae. And here's another picture just to illustrate what happens arthrokinematically or through the vertebrae itself when you bend forward and when you bend backwards. So as you perform flexion exercises, which is the one on the left, you can see there that the foramen opens up, it widens, and it allows for space. So if you have stenosis and you're doing flexion exercises, this is going to help you. Whereas extension exercises, when you're going back, it closes that space, but at the same time, look what it does to the disc. It pushes that disc away from the nerve, okay? Very important to figure out which one it is that you're dealing with. And this is just a picture of the vertebrae in side bending. So the same thing happens. When you go to one side, you're closing that side. When you go and opening the opposite side. So if you're going side bend to the right, you're closing the right side, you're opening the left side. All right. So now it leads us into our last dysfunction or cause of back pain, and that is SI joint pelvis dysfunction. Now, this is one that is very commonly overlooked because a lot of the times people are diagnosed through MRI or through X-ray, and they don't do the specific tests that are required to identify if it's the SI. Now, the reason I say that is because when you have true SI pain, when you do your motion testing, it's going to give you pain with flexion, and it may give you pain with extension too. So you may think, oh, it's all disc or stenosis, but you know, when you evaluate the SI, if you do that, you're going to find out if it's the SI. Once you fix the SI, it's going to fix the rest of the blocks on top. So if you think of your SI joint as the foundation of your spine, you know, and you're building blocks on it, if you have a nice stable foundation, you're going to have a nice straight spine. But if you have a very unlevel foundation, then the blocks that lay on top of it are also going to stack in a way where they're unlevel. Well, if you go through an MRI or an X-ray, you're going to see that your back is very messed up, or it's crooked, or you have bulges, or you have stenosis. But if you evaluate and you find that the SI is a primary problem to that, you know, and it's affecting the spine, once we correct the SI and we level it back out, those segments also level back out. So you're actually correcting, you know, your stenosis or your disc problems at the above level of your SI once you fix the SI, if in fact the SI was the primary cause. So, you know, it's commonly overlooked. We always screen it. We screen every time we do an eval, we screen it. Any type of back problems, we screen it, we check it. Any type of hip or knee problems, we check it, because it's been found to be involved in a lot of the pain that people come into treatment for. Knee pain, hip pain, back pain, neck pain, contributed scoliosis, leg length problems. So there's a lot of things. But anyway, when you have a true SI problem, this is usually caused by trauma or fall landing on your bottom. That's the most common. But, you know, other things can also happen. It can happen in contact sports. We see it a lot in softball pitchers because of the way they pitch and the rotation that they have to do in their pitching motion. Pregnancy is very common because of the ligament laxity that occurs and how, you know, there's excessive movement there when the hormonal changes that occur with pregnancy in females. And not only that, the way their pelvis is shaped compared to a male's is different. So it puts them at higher risk for those things. A lot of these individuals, they feel out of balance. They'll say, oh, well, you know, I walk, but I kind of feel like I'm losing my balance to one side or the other. And then here, you know, a lot of the times it's accompanied almost always by a muscle injury, you know, growing strain, hip flexor strain, pain in the front of the hip, IT band piriformis, lower back muscle spasm. So a lot of individuals, sometimes they don't even know they have an SI problem because they come in and they say, hey, I have pain in my inner thigh. And then it's like, okay, you check them out and you're like, oh, you have an SI problem. They're like, well, why do I have pain in my inner thigh? I was like, oh, that's very common, you know, because it is. So, you know, they may think it's just a strain, but it's something that's happened and been there over time because of this SI problem, and now they're barely figuring it out that it hurts and it's causing them issues, and that's when we see them for physical therapy. So this condition here will give you pain with sitting, getting in and out of the car, and rolling over in bed. So anything that requires rotation or torsion of your SI, it's going to cause some pain. And then the main thing here is that SI joint problems, if ignored, can lead to stenosis and herniated disc problems. So this is what I was talking about the tower before. So if it's overlooked or ignored, it's going to cause other problems. The great news is that we know how to successfully treat it here at Pure Physical Therapy, and we've treated a lot of individuals with it. And I'll tell you right now, if you have pain that has not gone away or just keeps on coming back and you haven't checked out your SI, it's probably your SI, so you need to come in and check it out. All right, so here's a picture of the pelvis and what I was talking about. You know, if you have an upslip or rotation in one side, you know, it's going to cause an asymmetry here. And if you cause an asymmetry here, it's going to cause dysfunctions up the chain. A lot of the times individuals have an anterior rotated pelvis, okay? And when that happens, you become associated with this cross syndrome effect that happens. So as you see here, we're getting a stretched abdominal wall. That's going to cause weak abdominals. And then we're also going to cause weak glutes and hamstrings because we're stretching here. So stretch weakness. And then here in the back, because of the increased lumbar lordosis, you're going to have tight back extensors, and you're also going to have tight hip flexors because of the anterior pelvic tilt. We'll fix all that. We identify that too before you come in. All right. What's the number one biggest mistake that we make? Well, the number one biggest mistake we make is that we ignore it. You know, a lot of individuals say, well, I wish I would have come sooner. I wish I would have known about you sooner. You know, they know they've had back pain for years and they let it go on to the point where they can't walk, and then they come in and things of that nature. So don't ignore it. You know, if I ignore it, I don't pay attention to it. And if you don't pay attention to it, it's going to get worse. And if it gets worse, it's going to start limiting the mobility, and to the point where maybe you can't enjoy the lovely times with your family and get you disabled, and nothing good happens after that. So don't ignore it. Seek out treatment, seek out information. That's why we're doing what we're doing right now, so that you can learn about it and get better. All right, so for opting in to watch this offer or this presentation, we have an offer for everyone. And that is, you know, we want you to reserve a consultation. If you have back pain, if you're dealing with some back pain or sciatica that hasn't gotten better, and you just saw this video, you qualify for a consultation. And the way you do that is by calling our office at 956-994-8880 and talk to one of our staff members, Bruce or Clarissa, and they can set you up. What I'd like you to do too is also join our new private Facebook group. This private Facebook group is a group for, you know, individuals that are wanting to learn how to heal naturally without back pain, injections, medications, or surgery. And, you know, it's a way to be in a community of other members and, you know, feel, you know, like, you know, to help you get through some of the things because other people have already gone through it. But not only that, you're going to have direct access to therapists, ask questions. We're going to throw in value content in there and blog posts and stuff on all our conditions, throw in some exercises. So to really just help you out and try to help you manage your stuff at home. So, you know, again, if you'd like to get a consultation, just call our office. Please join into the Facebook group. We have a private Facebook group and we have a business page. Go ahead and like our page as well. And then, you know, if you have any questions, you can always message us there. But, you know, I'm super, super stoked to have been able to give this information to you. You know, I want to end off by letting you know that if you do have any questions, just go ahead and post them in the comments below. I will see all the questions and we will answer them, you know, in a timely manner so that you get the information you need. But just know that, you know, at Pure Physical Therapy, you know, our purpose is to help you live a pain-free, healthy life, you know, unhindered, so that you can be able to do all those lovely things with your family and not let the pain control you. We want you to control your pain. So I hope you enjoyed this video content. Again, if you have any questions, just put them in the comments below. And I want to leave you with this. Stay pure.